Hello everybody. Thank you very much for inviting me to present our work about peer support on World Kidney Day 2021. I'm Nikki Thomas. I'm a kidney nurse. I'm Professor of Kidney Care at London South Bank University. I'm now going to share my slides to explain the work that we've done. So as you can see, I'm going to talk about peer support in kidney care, and I'm presenting this work on behalf of the peer support project team, members of whom were from King's College Hospital. You'll see O'Leary Wood there, who's a very good colleague of mine, a renal nurse consultant, a very big hospital in London, and also other members of the team who were from both the university and the hospital. So what is peer support? So peer support, I'm sure many of you are familiar with this idea, but it's where people with shared characteristics, conditions or circumstances support each other. So for example, peer support in kidney care is where people who are living with kidney disease, either people who are having dialysis, for example, or had a transplant, or even people who are family members of those patients, support each other. So support other people, other patients, other family members who are in similar circumstances. And really peer support is in three main areas. It can either be giving support around information, so it might be information about different types of dialysis, for example. It might be emotional support, so supporting people who are really struggling with their conditions, struggling or being overwhelmed with having a diagnosis of kidney disease. Or it may be around decision making. It might be supporting people to make decisions about which type of dialysis might be best for them. So what did we do? How did we find out about peer support in kidney care in the UK? Well, this project was very kindly funded by a charity, Kidney Care UK, and it was in three parts. So the first part was a national survey to all the UK renal units. It was adapted from a survey that was carried out in 2012. So we were able to compare from 8 years ahead what the situation was. And we were really looking at what the availability of peer support was compared with 2012. And we had some extra questions this time about barriers and drivers. So meaning what were the things that really made peer support happen and what were the things that stopped it happening. And what we did was we had interviews with patients as well. We had interviews with peer supporters and we had interviews with staff in 2 renal units. And the end of the project meant that we developed a toolkit, a way in which we could help hospitals and charities, for example, to set up their own peer support programs. So what did we find? Well, in the survey, we had about half the renal units in the UK responded, and they suggested to us that most of them offered peer support, and about half of those people who said they had peer support, some offered informal peer support, meaning that there wasn't a very formal program, and another half that they had a much more formal program which involved training volunteers. And we asked them, what do your peer supporters do? And some offered all three of these, but you'll see there 28 units offered what we call informational support, so giving information about kidney disease, about different therapies. 24 offered emotional support, so just as I mentioned earlier, supporting people who emotionally and psychologically when they have the condition. And about 24 units also offered decision-making support. So the support was there to help people make decisions about different types of dialysis or transplant, for example. What did we find in the interviews and also indeed in the surveys? Well, actually, we found there were certain drivers to getting peer support programs up and running and to keeping them going. And the first thing, of course, was that you've got to have committed staff. You've got to have committed staff working in the renal units who actually want to develop and sustain peer support programs. In other words, you have to have champions. You have to have one or two people who are staff members who are willing to take it on, and they might be nurses, they might be counsellors, they might be doctors. And you also need the people themselves, the peer supporters, the volunteers, who they themselves need to be champions for peer support. But what makes things stop happening? Well, it's the usual thing in the health service, that it's lack of time. Quite often it's lack of guidance. People don't know where to go for help. They don't know how to set up programs. They don't know other people who set up peer support programs. It might be that other projects take priority. And of course, with COVID recently, all health services have been preoccupied with COVID. And it might actually be that there are too few peer supporters, so actually not enough people who volunteer to take peer support on. From the interviews, we found that there were benefits, and I'll let you read this, but it's essentially about actually having somebody there who you can talk to who's in the same situation. And a lot of patients talked about this. One of the messages was actually we need to have formal programs. We need to be thinking about training of peer supporters. So I'm sorry, there's something that's been missed off there, but I think we have to train our peer supporters quite carefully in terms of what we're trying to do. And also, actually, you've got to invest in the programme. So you've got to have a system in place that's not dependent on one individual. You've got to make sure you resource it, maybe not necessarily with money, but with people, and that it's valued, and you've got somebody to spend the time on it. So what does this mean? So we had the findings of the survey and we had the findings of the interview, and we decided that really we needed to share our experiences of peer support. And the easiest way to do that was to develop a toolkit, and you'll see the toolkit here, and it's freely available, freely downloadable. And this was very kindly funded by Kidney Care UK. But if you go onto this site, you'll see that there are lots of resources there available for you to use. So as an example, if you're thinking about setting up a training program, there's things there to think about, how you would go about it, how you would recruit people, how you would train people. There's a slide set for you to use in your training. It might be that you want to advertise your program, so there's a template there which you can use for advertising. So I would really strongly support that you go to that website and download some of the materials. So finally, what is it really we need to do? How do we need to improve the situation in terms of peer support? I mean, more work needs to be done. We've seen, certainly in the UK, if we look at 2012 and we look at 2021, actually there's no more peer support than there was 8 or 9 years ago. And we've tried to identify the reasons why. It's around money, it's around time, it's about people being committed to it. So we absolutely need to do more work. We need to think about our findings in relation to COVID. We need to be thinking about virtual peer support, and people are much more able now and have technologies which enable, just as we're doing now, talking virtually to people. And we have evidence that shows that actually supporting people virtually can be as good as having face-to-face. And of course, it's not always as good, because you might want to, I don't know, show your support by holding somebody's hand, for example, or giving them a hug. And actually that's not possible, is it, in a virtual world, and we're all missing that. Actually, we need to work locally and nationally to support individuals to set up peer support programs. And maybe in different countries or in different localities, people could work together to do this, because in this virtual world, you don't actually all need to be from the same renal unit. We need to think about our toolkit. We need to look at how well it's been received, and actually, are there some things missing? Are there some things that could actually we could put within the toolkit which would be of use to people? And perhaps one of the most important things is that we need to think overall about the impact of peer support in kidney care. We do have some studies, but actually it's not going to be very well accepted by all unless we have some hard evidence. What difference does it make if you have a good peer support program? So I've come to the end of the talk. I hope you're all having a very good World Kidney Day. There's all sorts of activities that are going on around the world, but I've worked in kidney care all my career, almost 40 years now. I'm absolutely committed to this whole idea of peer support, because we know that generally we don't support people with kidney disease very well in terms of giving information, in terms of supporting people emotionally, and indeed in facilitating shared decisions. So I'm Nikki Thomas. You're very welcome to email me with your questions or your comments. Thank you very much.